Hi everyone, today I'm going to be filming episode 3 of my YouTube series documenting my experience with osteosarcoma. I've filmed this episode a couple times, um, and I just haven't been happy with any of them, so I included like an outline for this one. And I wanted kind of what feelings I had about the second video to kind of gestate for a bit so I could move on from it properly. So to start, where we left off was my scans showing that my cancer hadn't spread anywhere and that the two things on my skull were not cancerous. They're not really sure what they are. So I had the surgery on April 14th of this year, 2021. The surgery is called a limb salvage surgery. So what that means is they try to keep as much of the limb intact as they can via a combination of removal of cancerous tissue, non-cancerous tissue, and then implementation of metal prosthesis to replace what was removed. It's a relatively new surgery. I believe they've only been doing it for like 25 or 30 years, and in the past the only surgical option was available was just amputation. I was given 5 surgical options, the first one being amputation, the second one being limb salvage surgery, the third one being, I forget what it's called, but it's basically like a limb salvage surgery, but instead of replacing the bone with metal, they replace it with cadaveric bone tissue. And then the last 2 options were explained to me, but they're not really used on young people that have this cancer, that have already gone through puberty. One is called a rotationplasty, where they basically cut the part of the leg that has the cancerous tissue off, and then they turn your foot around and implant it up where the knee is, so that your ankle kind of acts like a new knee joint, and your foot is the base of your prosthetic. But they said that that's typically only done with children, because they kind of need like the bones to fuse together properly, and you can't really do that with an adult. And then the last one was one that my surgeon said they give to elderly patients that either for like palliative reasons or they don't have a long life expectancy to begin with. They basically replace the entire knee joint with like a bone shunt or something like that. I believe that was the word he used, to where there is no knee joint and the leg no longer has flexibility, and it's just used for walking and stability primarily. So I chose limb salvage because he told me that that would really be the best option, and that recurrence rates are not affected by whether or not you amputate the leg or do limb salvage. Like I said, I had the surgery on April 14th. What the surgery entailed was an incision from a little bit above my knee all the way down to like the lower third of my lower leg. They peeled all of the tissue and muscle back to get down to the bone, determined that my blood vessels and nerves were unaffected by the cancer, like it hadn't grown into them, and they moved them to the side. And then they cut out 11 centimeters of my tibia bone, about 2 centimeters of my femur, and then the end of my fibula, so I guess like 1 or 2 centimeters, just the part that was connected to the joint. So once they took those pieces out, they then hollowed out the tibia and the femur about 6 inches up the femur and 6 inches down the tibia, to put in the stems of the implant. And then the implant itself involved a total knee replacement implant, like a hinge joint attached to a tibia resection replacement. So like a big piece of metal to replace that part of the bone that they cut out. And then what they do after that is, because you are losing the part of your tibia bone that your patellofemoral tendon attaches to, they attach it to your metal implant via a hole that's wired through the implant. I'm sorry, a hole that goes through the implant that they take the tendon and wire it through the hole. And then to protect that structure, they take your gastrocnemius muscle, they take the medial head of it from your upper calf, they cut it, release it, and kind of peel it up and over onto the metal implant, both to act as protection for the implant and protection for the tendon. And then the idea with that is that the scar tissue from the tendon will fuse to both the metal and fuse to the muscle flap, and then the muscle flap itself will fuse to the metal as well and the tendon. So it's just a whole bunch of scar tissue all working together to protect that tendon, which will cause problems later on, but I'll get into that. And then lastly, the most positive thing about the surgery for me was when they did pathology on the tumor, they found that it had negative margins, so it hadn't spread into any surrounding structures, and that the necrosis rate was 70 to 80%, and the reason they gave it as a range was because my tumor had a lot of fibrous tissue, and I believe they were kind of unable to tell in some cases whether or not that was dead or alive, which I didn't really understand. So in that respect, I was glad that the tumor had negative margins, but I was a little, I guess, disappointed with the tumor necrosis, because the level of necrosis can affect the prognosis, and anything below or anything above 90% is considered good. So because I was below that target, that did scare me a little bit. But my surgeon had told me, like, it doesn't affect the prognosis too much, so hopefully he wasn't bullshitting me. But that's definitely something that's been on my mind for sure since then. So next I'm going to show the x-rays and talk about them briefly. So this first x-ray that you're looking at is a frontal view of the knee. So if you can see, the piece of the tibia that they replaced is attached to the hinge joint that goes up into the femur. And then if you see like that circular structure, that's basically just the staples that they put into the skin graft to make sure that it holds while it's healing. Then I have a side view going up my femur bone, so you can see there just how far up it goes into the bone. And then lastly, there is a side view going down into my tibia, again, just so you can see how far it goes into the bone. So I'm also going to show a picture of my surgical scar, which you can see here, and then a picture of my skin graft on my upper thigh, which I'll talk about. So when they finished the part of the surgery that involved the deeper tissues of my leg and went to suture it up, they noticed that there was not enough, I guess you'd say, like skin coverage with the incision to where they could like adequately cover that new muscle flap. So they took two rectangular pieces of skin from my upper thigh and then basically like put them into the area that was deficient from the muscle flap, and then staple it together so it would heal. And if you notice in my picture of the surgical scar, it's all healed up at that point. It healed after about a month or so. So the next part I want to talk about is kind of just my struggles that I dealt with like after the surgery. I spent 1 week in the hospital in a tremendous amount of pain. I remember the day after the surgery, they had me do x-rays and they changed my brace, and I was practically screaming the whole time they were manipulating my leg. And then I remember the fourth day they made me get up and walk over to the chair, which was really bad. And then I told them I wanted to sit in the chair for a while, and I believe my fiance told me that I called her, and then within 2 minutes I was like wailing to have them come get me back in bed. So then on the last day in the hospital, they had me do like 2 steps on like a little staircase that they had in the rehab room to make sure that I could do that, because the way that this implant is designed, it's full weight bearing as soon as you are done the surgery. And then when I got home, I have 18 steps to get up to my apartment, and those 18 steps were probably the hardest thing I ever did. I want to thank my brother who came to town for a week to be at home with me, and he helped me up the second set of steps because I just couldn't do it. I was going to fall over. So after that, it was all, just recovery. I spent a lot of time in bed, mostly. We had moved my television and my PlayStation into the bedroom. And then I want to say like a month after the surgery, my surgeon told me that I started to form what's called a eschar at the bottom of the incision, which is a collection of dead tissue. So I thought it was just like a scab, and they decided to pull it out at that particular appointment, and when they did, it revealed that it was actually a incision crater. So it was a hole at the bottom of the incision in my leg about as deep as the end of a Q-tip. They told me that I would need to consult with a plastic surgeon to determine whether or not they wanted to put a skin graft on it or what they wanted to do. And he, at the end of the appointment, he numbed it with lidocaine and then sutured it together. But even then, there was still like a dip, and it was really painful. So I saw the plastic surgeon, and he told me that the best plan of action to not delay any chemo was to just let it heal naturally, not to do any further plastic surgery or anything like that. Which I was glad to hear, just because I didn't want them to do anything else to my leg at that point. So he also told me that my fiance or whoever was supposed to change the dressing every day and put some kind of disinfectant agent on the incision, and for about a month that was very, very painful, just because it was like open, exposed, raw muscle tissue, I guess, and it was just like, just excruciating. And then because my muscles in my leg are very atrophied, when she would pick up my ankle to like get my leg up straight, the implant that I have has like a stopper piece to prevent the leg from overextending and the implant breaking. And like when she would pull the leg up, the stopper piece would like hit onto the crossbar piece, and it made like an audible like clicking sound. And that was like, number one, it was very uncomfortable, and number two, it was very painful. So that just kind of sucked. So here's a photo of the incision crater. This was after it was sutured up, and this was about when it was almost healed, because those top 2 parts are basically just scabs, and then they eventually just fell off, and then it looks kind of like an oval now. So it's an oval of scar tissue that still has kind of like an indent in it. And then the crater healing, we didn't realize would take a while, so that took about a month, and that delayed my chemotherapy by 2 weeks. So I had another round of scans at the beginning of the month of June, and they were all clear. No new growths, no evidence of metastasis. So I was very relieved, of course, and I started the second round of chemotherapy on June 12th. And then after that, my surgeon had told me, see how you're feeling the first couple days after chemo to determine whether or not you want to start physical therapy. And I wasn't feeling too bad. I was actually not nauseous or anything, so I started chemotherapy on June 24th, but I will talk more about the second half of chemo and more about physical therapy in the 4th and 5th videos. So, thank you for watching.